Hello, everyone. Welcome to a Facebook live chat with an expert session. We'll be hosting these sessions every Tuesday for the months of May and June to discuss some of the common concerns caregivers are experiencing during this pandemic. My name is Padma, and I'm a learning specialist with the Alzheimer Society of Calgary. Today, I'm very pleased to have with me Dr. Mangat, Geriatrician with University of Calgary at Rocky View Hospital, with clinics at Rocky View Hospital as well as in Airdrie. Dr. Mangat is well known to the dementia community in Calgary and has generously donated her time to do Facebook chats with us in the past. We are planning to spend about 20 to 30 minutes on the topic of caregiver concerns. We invite you to ask questions for Dr. Mangat in the comment section of this chat, and Dr. Mangat will answer them during the course of this chat. Considering the very public nature of Facebook, we request you to avoid personal questions as far as possible. If you can make it general, that would be much appreciated. I would also like to remind you that this session is not a substitute for a medical consult. So if you do need specific medical advice for your situation, please do consult your family physician. So first of all, I'm beginning this chat by welcoming Dr. Mangat. So welcome to the chat, Dr. Mangat.
Thank you.
Let's begin today's chat with the topic of how to help a person living with dementia who does not understand and remember the precautionary measures recommended during this pandemic, such as the need for social distancing, frequent hand washing, etc. So what would you suggest? What strategies would you provide for a caregiver who is struggling with the situation?
I think always we have to remember our basics of communication with anybody with any type of dementia. Mm-hmm. Communication strategies should always include verbal communication, the words we use, mm-hmm. Nonverbal communication, our body language, for example, when we convey our communication, and even paraverbal communication, which is, for example, the tone that we use when we communicate with mm-hmm. someone. And whenever we deliver any kind of messaging, whether it's during the pandemic of COVID-19 or on a regular day-to-day interactions with a person with dementia, we have to be consistent. Mm-hmm. We have to be calm, and we have to be positive in our communication method. Mm-hmm. So my recommendation, whenever you encourage and tell your loved one or who you're caring for how to perform a task, first, be calm, be positive, and be consistent. Mm-hmm. Social distancing has been hard for all of us mm-hmm. to understand. There have been so many messages of what social distancing is, what physical distancing is, when to begin, when to stop. But develop on your own, knowing your loved one, knowing their communication strategies or how they respond to your communication ways, your cultural context, and develop a simple sentence that you can say calmly, positively, and consistently. Mm-hmm. For example, many people are afraid of the word virus. So if I was communicating to someone with dementia, whatever stage they may be, mild, moderate, severe, I wouldn't use the word virus. That's personal communication. Mm-hmm. I would use flu or the bug, mm-hmm. something that they can comprehend. Mm-hmm. Then I would say calmly to say, there is a new flu out there, mm-hmm. or there is a new bug out there, mm-hmm. that when people talk or they sneeze or they cough, mm-hmm. other people can catch that bug. Right. And we don't have a treatment. Mm-hmm. That's why we have to stay at home. And look, our neighbors are staying at home, our kids are staying at home, mm-hmm. and you have to complete that with a consistent, positive, calm demeanor. If you're anxious, your loved one with dementia will be anxious.
Absolutely.
And same goes to teaching hand hygiene. Mm-hmm. Everybody can learn a new habit. It just may take a little bit longer, and people with dementia too can mm-hmm. pick up a new habit. But part of that also involves more work on the caregiver to be consistent and positive. No one with dementia is going to pick up perfect hand hygiene, probably the first few weeks. But overall, you're achieving for an end result of consistent, good enough hand hygiene that will slowly develop into pretty good hand hygiene.
Yeah, great. Yeah, that's those are very wonderful, very, very helpful strategies, I should say. In terms of, the person forgetting, what could we do? Could we use something, write up something and keep it there? Or have some video done and show it to the person, just to eliminate that frustration for the caregiver, who has to keep on repeating the same thing again and again. What would you suggest, Dr. Mangat?
And I would make that note that people with dementia are not the only ones that need to have hearing as to how to do hand washing.
Right.
These strategies, which posters, YouTube videos, are all over the hospital, all over our clinics, even all over my home. And so the CDC and even canada.gov.ca has a great one page that you can print that is simple, that just has simple graphics that you can print and tape beside your sink. And every time you do a hand washing with your loved one, say step 1, this, step 2, this.
Yeah.
And many people sing, you're supposed to wash your hands for 20 whole seconds. So have a song. Talk about something for those 20 seconds, distract them, and then they'll wash their hands. And then you have made a fun activity out of it as well.
Great, excellent. That's very good strategy. Yeah, I agree. I remember seeing that. It's in a blue and white or gray and white, some kind of a background. Yeah, I will attach it to this chat so that, people who have not seen it before, they can maybe download it, print it, and then keep it, stick it near the sink so that the person can see it all the time. And maybe, there's a cue is for hand washing, the 20 seconds, as you said, is a song. That's great. I like that idea. Yeah, wonderful. Yeah, so that's great. I'm not seeing any questions yet. So in the meantime, I'm going to ask you another question. Okay. So now that we are embarking on Alberta, relaunch Alberta phase 1, right? Slowly some businesses are opening up. I heard some saloons are opening up. Some of my colleagues are booking appointments to have a haircut that is long been due, things like that. So like this might mean that some small gatherings might be taking place as well. Families who have not met for a long time, the extended family members or grandchildren might want to visit the grandparents. And again, that creates another layer of, challenges, because the grandchildren are visiting, the grandparents can see them, but again, how can the caregiver ensure that they are maintaining that physical distance and kind of controlling their urge to hug their grandchild, or what would you suggest in that situation?
And it's going to be a challenge for both the caregiver of someone with dementia, but also the parents of the grandkids who want to come and visit. You have to teach your grandkids and you have to teach the person with dementia. How I would approach this, and again, I always give the caveat that you should approach your communication style with your loved one as you know them, with the cultural context that you live in. But I would approach this by saying, it looks like that new flu or that new bug is starting to come down in numbers. Or things might be a little better, but they're not great yet. So we have to still be careful with our grandchildren. We can't hug them yet, because just us talking or them talking near us could give us the bug or could give them the bug. And that would also be something that the parents can use potentially as a strategy, because it will be heartbreaking to come and see yet not hug. And physical touch, human touch is so important part of our relationship building. And I think that's been the hardest part for many caregivers, to not have that day-to-day additional relationship and social interaction that their loved ones and neighbors would also have provided.
Right. Yeah. So I was just wondering, like seeing the grandchild right in front, and having to again remind them, no, you cannot go and hug. And that might even, caregivers might be concerned, won't that affect the relationship I have with my person with dementia, that I'm stopping them all the time? I'm like the bad person. So that around that, what would you suggest? Like, instead of telling them, no, you cannot do that. What else could they try?
So that's a very fair concern,
Yeah.
that I am constantly being bad cop, that I never give them a pleasurable activity, and especially during the pandemic.
That's right.
But I would recommend that and advise that relationships are far more resilient than short-term setbacks. Right. And if you are, again, consistent, calm, and positive in your messaging, then the person with dementia who's relying on likely your nonverbal and your paraverbal cues will be able to understand that this is not that anxiety provoking a situation. If I can't hug and my loved one who's my caregiver is calm about not hugging the grandchildren as well, maybe it's not so bad. But if it's something that as a caregiver you're anxious about, and you present anxiety in front of the person with dementia and your grandchildren, the nonverbal cues will convey this is an anxious situation. It's still not good. And I know, again, it's a lot to put on a caregiver, to be calm, to be positive, to watch your communication style. But again, it's something that you have to do with a person with dementia regardless, pandemic or not. And so when a person who's a caregiver has the good habits of calm, positive communication, the person with dementia will also pick up and be calmer than they could be in that situation. Yeah.
It's so very important that the person's, the caregiver's emotions can be very easily picked up by the person living with dementia, and they can kind of reflect it back onto them, right?
That's right.
That's something that caregivers need to keep in mind, and always be mindful. Might seem like one more task now I have to take on, but these situations are such that that is required at this point of time, right? Dilpriya, I have another question. Now, would this relaunch Alberta Phase 1 mean that now families can visit, the person living with dementia in a care home? Is that still allowed, or how would that pan out? What's being planned?
I think they're still providing guidance on that. And I think it will also still dependent on care home versus care home, as each care home has had different levels of outbreaks. And I would, rather than giving a general statement, I would ask you to reach out to the care home your loved one is in. Understanding what the degree of outbreak there was, as we know that some facilities or locations have had far higher numbers than other locations. And then should the facility or the long-term care home or the supported living that your loved one is in allow visitors, or they have their own policy, I would comply with that policy. And I would look towards ways of minimizing initial visitor contact.
Right.
I recommend designating one visitor, perhaps, if your facility allows for it. I would recommend that you practice all appropriate hygienic methods. And if you're required to wear a mask by the facility, you should. Right. I would recommend that you limit your contact with your loved one to the degree that you should, as recommended by the policy of the facility you're going to. And I would advise you that this time will pass. It has shown us how important relationships are. And it has shown us how difficult it is when we cannot see our loved ones, which we took for granted. We really all did. And it has been a very anxious time period for everyone, especially for those whose parents are in long-term care homes and you haven't been able to see them. But again, complying with your individual long-term care home policy, understanding that they are still managing outbreaks potentially, understanding that this time will one day pass, I hope will give people the support and encouragement they need to visit carefully and cautiously.
Great. Yeah, wonderful answer. Very well thought out, great. One more question I'm asking. I don't see any questions yet from our viewers. So I'm just asking a question that comes to my mind. So we talked about, again, people are able to visit and have small gatherings. What would be your general advice to families? Is that okay to invite the extended family members, as long as it's a small group of less than 10 people, to visit the person living with dementia, or should they be careful about limiting those kind of direct interactions? What is your opinion?
Well, you're asking a physician, and I'm going to give the advice that I understand that things are opening up. But I also want caregivers and loved ones of people with dementia to know that we cannot assure that the numbers will remain low. We don't know this virus. We are learning about the virus. It requires everyone to continue to practice reasonable social distancing. If you can continue to visit with your loved ones by phone, online, FaceTime, for example, means, I encourage you to do so. Dementia itself on its own, it's not an illness that increases your risk for COVID-19. But often people with dementia have more comorbidities, more illnesses.
Absolutely.
They are more susceptible as caregivers. Potentially caregivers are as well. So while our society is quote unquote opening up, I would recommend people to be cautious, to be mindful, to be understanding, as we are still learning about the virus. And if you can slowly yourself introduce social gatherings to the loved one with dementia, I think that would be most appropriate.
Great. Yeah. I agree with you. Yeah, that's the right strategy, to be careful, to be safe rather than sorry, right? I was just, just this last weekend, I took a drive to Genesh, and I was shocked. You wouldn't believe, I was shocked to see the number of cars lined up there. Any of the spot where there is like a picnic spot where we could go and have a walk, or there's a trail or something, there were cars back to back to back. It scared me, even though I do not have any long-term chronic condition, and I don't have any person living with dementia or anyone in that high-risk group in my family, except for my own age. I was very nervous and I didn't want to get down. So I just watched and drove all the way up until about Canmore, and then stopped at a very deserted place. There was nobody there, no trail, but then I could park the car and then just have a walk along the side. So somewhere around small deserted area, that's what I did. So I think this is kind of where you are, based on your comfort level and based on your understanding how much risk you actually want to take, right? Yeah, it's a kind of a personal decision for the caregiver, I guess, to their discretion. But
yes, any step you take is your own personal decision, and you have the autonomy and the right to make your own decisions. And I'm not discounting that it has been a very difficult few months for many people. That to be isolated has been an extreme challenge and will remain an extreme challenge. No one can thrive in isolation. However, what I'm suggesting is that one day things will improve, but they depend on all of us to make the appropriate decision. I can't make the decision for anyone, and no one can make a decision for me. I can't fault anyone for rushing to a park finally for good weather that we've had.
Yeah.
However, I can choose to make the decision, and I can choose to give the recommendation, which is that the numbers still remain there. The virus is present. We don't know the virus as well yet, and I recommend caution. However, I also appreciate that people with dementia thrive when they have exercise.
Yeah.
And this just requires a bit more ingenuity on your balcony, maybe a bit more in your backyard. Maybe give them a pot that they can plant one plant in. Walk in small amounts in your neighborhood. Assess parks before you go. Right now, parks opened up, and as you're mentioning, people flock to them. Again, I don't fault them. It's hard to be cooped up. But those with dementia, caregivers with dementia patients have to understand the comorbidities that come with aging for many people. And there's no harm in continuing to practice caution. It's only a positive benefit.
Absolutely great. So we have one question here. I hear concerns from family members stating that they are worried their loved one with dementia will not remember them due to limited visits in facilities. So how does one respond to that?
That's a big challenge of dementia, of all the dementia types out there in general, that when the memory impairment, short-term and long-term, really present themselves, when people with dementia forget themselves, forget who their loved ones are, regress back to a different time period, that in itself is a very traumatic scenario for many of the loved ones who have family members with dementia. And I can appreciate that the distance of not being able to see your loved one, touch your loved one, hug your loved one, may make you feel that they will lose touch with their memories earlier. And I cannot say that's not true, and I cannot say that it may not happen, but the risk benefit has to be understood. The risk of transmitting an infection or acquiring it yourself, I think, far outweigh the situation right now. But this also requires a bit of ingenuity, which I appreciate requires the costly method of technology. Not everyone can have a phone, iPad with video conferencing abilities. However, if you can, or if you can donate to your facility an additional one that you have, and setting up routine, small amounts of chats. People with dementia have a very short attention span. But if you frequently talk to them on a routine basis, for example, every morning after breakfast, one person chats. Every morning after lunch, one person chats. Every time at supper, one person chats. Small, continuous conversations, they will adapt, they will remember. It may not be ideal, but it is something that has to be considered right now.
Great. That's a very useful strategy, very useful tip, especially considering, the fact that people with a person living with dementia may not have that much of a long attention span. So limiting it to just one person and not everyone crowding in the Zoom chat or Facebook chat, FaceTime, not everyone crowding in, because that can be scary too, right?
You actually brought a great point. In general, people with dementia, they cannot handle overstimulation on a routine day-to-day basis. Then you add technology, which is not part of their natural forte. And then you add multiple screens, multiple volumes, tones, backgrounds. It's very overstimulating. It's best to keep it simple, one person at a time. Best to keep the noise level minimal. Best to keep background noise and garish background screens at minimal, keeping in mind that too much stimulation can lead to disorientation. So limit the stimulation to one simple screen, one or two people, simple conversations where you engage them in the conversation.
And also positive conversation. So no mention about, virus and how it is scaring them or things like that, avoiding those, and just talk about some pleasant memories from the past or share something positive, right? Keep it positive.
Absolutely. Absolutely. Which you should do on a day-to-day basis as is.
Yeah, great. Yeah. And then I was just last week, I did mention it in last week's chat as well, but I would like to get your opinion around that. And that was about a family, caregiver's concern. She was not able to go and see her dad, who is in a care home. And initially, before the COVID situation emerged, she and her mom would go and bathe, all the help with the personal care task, like personal hygiene task, like giving a bath or shaving, that they used to do together. So the person never actually got a chance to interact with the staff in the care home. And now with this situation, they have not been able to go. And, naturally the person is getting agitated around the staff. And the mental health, her concern was that mental health has been insisting that because he's so agitated, they had to start him on some medications, some antipsychotics. And surprisingly too, it was kind of, if you look at how quickly they initiated the antipsychotics, and he was put on 2 antipsychotics, increasing the dose every week. So not even waiting for a couple of weeks to see if, how it is panning out, how it is, what is the impact, but then going to the maximum dose that is possible within a span of 3 weeks. He was on 2 high dose antipsychotics. And this person was just 60, in his 60s, very mobile, he's physically active. But she has now concerns that with all the medication and with his tendency to be physically active, would there be more falls? So that was a concern, and also about the side effects of all these antipsychotics. So what can a caregiver do when there is this kind of concern or insistence from the medical team who is taking care of that person in a care home, about that they have to put him on antipsychotics? What can a caregiver do who is not able to go and visit that person? What strategy can they use around that?
So I can't speak too much of the medical context because I don't know the context. But I can always say that the hallmarks of restless behavior are typically disorientation, no longer having some familiarity. Now, the challenge, of course, is that there was some familiarity with frequently going in the home and providing personal care, and the touch that came with that, and the interaction that came with that. In this pandemic, it has unmasked the vulnerability of our seniors, not Calgary, not just in Canada, but internationally. Many caregivers went to a different country frequently to see their, and they can't even fly anymore.
Right.
So for everyone who has a loved long-term care facility or a different city, for example, a daughter in Toronto with her mother living alone in Calgary, or a different country, for example, a loved one living in Canada, or their parent with dementia living in another country, such as England or India, for example. For every single one of them, there are many things that you, in this situation, are not able to manage as you would previously see. For example, staff.
Your voice is breaking up.
But what you can do before, restlessness, agitation often begin with our routine being disrupted. I don't know the medical context, so I can't speak to that exclusively. But perhaps that social interaction of the daughter and the mom coming in and giving a bath. That means that perhaps working with a care facility, that when he's now getting his bath, could we be on FaceTime? Could he hear our voice? Could we help encourage? Or creating a new routine that every breakfast, every lunch, every dinner, you're available to chat with him, to reorient him or her.
Yeah.
Everybody has challenges. everybody has to work with the current situation. And everybody has to look towards what novel communication strategies could we do with our loved one to reorient them, to limit their restlessness. And when they do have a pattern of restless behavior, can we please speak with them then?
Yeah, absolutely. That's a good idea. So you suggest that the caregiver can have a chat with the care home, the staff there, and then to say that request. And when this is happening, when the person is becoming extremely agitated and refusing to have a shower, or to have a change of clothes, or whatever is that they are refusing, at that time could they FaceTime? But I'm not very sure, Dr. Mangat, whether they allow these the healthcare aides there to use technology while they are with the person. Because initially, when I've heard from some healthcare aides say that they are not allowed to use their phones.
And that's absolutely fair and reasonable. But often behaviors have a trigger, or there's a pattern to them. And so if you know the bathing occurs at this time of the day, you could talk earlier in the day. Remind them that the bathing will occur this way, and then we will talk to you again after.
That's great. Another idea I'm thinking that I suggested later to the caregiver, but just checking your opinion on that, was that if they are sure that this is happening during bathing, that's a time when the person is most agitated and refusing care all the time, then maybe they could create a Facebook, not a Facebook, just a video, a YouTube video, a small video, or even something on their cell phone, create a video saying that, Dad, unfortunately, I'm not able to come and provide you, help you in the bath, but so-and-so, name of the staff there, she would be coming today, and she will be coming and helping you have the shower. So please cooperate with him, because, she's just your well-wisher, and she's just trying to help you. Okay, so
that's a strategy you could try. I would always use positive words. So I like the way you approached it. I would avoid unfortunate. I would have only used words that are positive. I would keep it simple. I would keep it consistent.
Yes.
And I would remember that as a caregiver, my communication style, my paraverbal communication, if I'm anxious on the phone, telling Dad to accept a bath, he's going to hear the anxiety. He's going to hear the emotion. He's not going to hear the words. So first, as a caregiver, you need to develop a calm, positive, consistent approach, and then take it to your loved one with dementia, wherever they are, so that they hear the calm, positive, consistent approach. The words won't mean as much at that point.
It's more of the nonverbal communication of seeing you smiling, at ease. That probably that pacifies the person, and they feel more comfortable.
Far more than words.
And even addressing the caregiver, maybe, by if they know her name, that staff's name, so my dad will be ready for you, something like that, connecting them together.
Absolutely. We all have to work with the situation at hand.
Right.
We can't change the situation. So how can you work with the situation and then present it to your loved one with dementia, so that you present it in a calm, positive, consistent manner? And I think people who are caregivers will also begin to appreciate that when you have the approach that's calm, positive, and consistent, you yourself will feel calm far more than you are feeling right now.
Right. I agree. This is a new learning for everyone. So even for the caregiver to be more mindful of their nonverbal communication, how they sound, how they look like, how do they appear when they are actually talking, all those are things to be mindful about. And the same would be like, when they see that the strategy is helping, maybe the healthcare aide too can use the same approach.
Absolutely.
And try to use the same kind of language, try to use the same kind of approach that the caregiver is using to get more cooperation from the person living with dementia, I guess, right?
Absolutely. And then you teach that care provider at that facility that these are the words that my loved one appreciates hearing.
Mhm.
This is the way they respond to communication. This is the communication style that works for them.
Mhm.
Nobody knows the communication style that works for someone else. They
That's
have to be made aware of that. And I
That's
think as caregivers, if you also calmly present that to any care aide, any care provider, they will also appreciate. Everybody wants to do their task calmly and
That's true.
pleasantly.
That's true. Yeah. And maybe using even music too, right? That's another thing that that can help.
Absolutely.
So playing the person's familiar favorite music whenever you are doing any task that can agitate the person. So then maybe there's a more likelihood that that bath will be a pleasant experience for the person because there is music
Yes.
that they love to listen to. So just even sharing that to the healthcare aide that this is my dad's favorite song. So if you can play that, he will be a little less agitated. It's worth a try, right?
Absolutely. And not just worth a try, it's been proven in studies that music therapy helps behaviors in dementia.
Yeah.
Provided that music is what the person likes to hear.
Yeah.
And you know yourself what your loved one likes to hear. Pick
Yeah.
a few of their songs and yes, give that to the care aide.
Yeah. Even dropping an iPod with all those the songs stored in there, that'd be easier. Then they don't have to access technology there. They can just give the iPod to the person and then have the earphones there and the music playing. And who knows, the person might break out into a song in the bath. It's a very rosy scenario, but still, that is something that you can always aspire for. Yes, strive for.
Absolutely. And I would work with the care facility that your loved one is at. Understanding their visitor policy, understanding things you can drop off currently with hygienic methods. And perhaps they themselves have tools that they can play the music. So working with the care facility first and then seeing what additional resources, if needed, you need to drop off.
Okay, so I do not see any more questions and we are nearing the end of our conversation. So first of all, I need to thank you. A big thanks to Dr. Mangat for sharing her valuable time and knowledge with our online audience today. We really appreciate having you with us. And I know how busy your clinical practice. I'm not able to speak today. How busy your clinical practice is at Rocky View and in Airdrie Hospital. And a big thank you to all of the others, our online viewers who participated in this chat or who are watching it in your spare time. We hope you found this session of chat with an expert helpful. Please join us again next Tuesday at the same time for a chat with Dr. Dawn Pearson on another topic that is new behaviors emerging since the pandemic, such as anxiety, agitation, paranoia, etc. I would encourage you, if you have any questions, please call us at 403-290-0110 to speak to a social worker one-on-one or send us an email at findsupport@alzheimercalgary.ca. If you like this video, I would again encourage you to like and share this video and follow the Alzheimer's Society of Calgary Facebook page for more videos in the future. So that's all from us today. Have a great rest of the day. See you again next Tuesday. Thank you very much.